Right. We're going to get started with our Center County ACAP presentation tonight. And tonight, first, let me introduce myself. My name is Holly Ray, and I'm one of the founders of ACAP Center County. And there's our website there at the bottom. And tonight we have Mitch with us. And Mitch is the owner and founder and operator of Vital Rehab and Wellness. And I'm going to let him take it over and introduce himself. And he's going to be talking tonight on fall prevention. All right, Mitch.
Very good. Thanks for the introduction, Holly. Like Holly said, my name's Dr. Mitchell Straub. I am the owner and founder of Vital Rehab and Wellness, and also lead physical therapist. Just a little bit about myself. I have been a physical therapist in the area here in Center County for just about 7 years now. Ever since my wife and I graduated college, we moved to the Center County area, and I've been practicing here ever since. I've been in a lot of different fields in physical therapy. I've worked in rehab, and I've done work in nursing homes and a little bit of home care as well. And just recently, last April, launched Vital Rehab and Wellness, which is a mobile therapy practice. So instead of you going to the clinic, we bring the clinic to you, and we specialize in helping older adults age successfully by helping them regain and maintain their independence. I recently joined the ACAP team as well here in Center County, so I'm super excited about that, and partnered with them today to come and talk to you all about falls prevention. So today we're going to be diving into some things that you can be doing and looking out for your older parents as they start to age and move through the spectrum of life, and things that you can look out for, some tips and tricks to help keep them safe at home. Because as we dive into the presentation, we'll talk a little bit about how big of an issue falls is with our older adults. So we'll talk about that. We'll look at the four systems that play a role in our balance and helping us stay upright. And with that, we'll talk about how each system changes as we age. Because as we know, as we get older, our bodies don't get any better unless we do something about it. So we'll talk about how each of those systems becomes affected by the aging process. We'll talk a little bit about the fear of falling and how fear of falling can impact our performance and our safety at home. We'll also dive into walking speed. Walking speed is one of my favorite topics because sometimes it can be a little controversial between what some of the science says and how I approach rehab, and some of what some of the family members think sometimes as well.
I'm back. Can you hear me?
We can hear you, Jill. We can hear you.
I can't hear you.
Oh, you're not able to hear me? And we're also going to be talking about some resources that are out there for you guys. The CDC, the Centers for Disease Control, has a lot of good resources, and they launched a program a few years ago called STEADY, and we'll go over a few of those resources as well today. So with that being said, I am going to start to share my screen here. I have a PowerPoint presentation, so I'm going to go ahead and get that pulled up. And hopefully over on your screen now, you are able to see the falls prevention PowerPoint. And at any time, guys, this is my first time going live here. So at any time, if you guys have any questions or anything, going live here on the computer is way different than presenting to people in person. I don't get the reaction from you guys. So if you have any questions at any point, just type them in the chat, and we'll pause the presentation and address those questions. Hopefully this can be pretty interactive, and hopefully it sparks a few questions that you guys have. So please feel free, if you guys have a question at any point, drop it down in the chat and Holly and I will get to it. So with that being said, falls prevention. So first, let's talk about fall statistics and should we be concerned? Okay. So first we need to understand how big of a deal is this. So falls rank as the 18th leading cause of disability adjusted life years across all ages. So it is the 18th leading cause of disability for all ages across the lifespan. So this is looking at disability causes for infants all the way up through older adults until for the end of the lifespan. So it outranks diseases like dementia and chronic kidney disease. So you can think of how detrimental those diseases are, and falls ranks even higher than those. If you have parents who are over the age of 70, it is the leading cause of injury-related death. So you think about how big that is. You're even outranking motor vehicle accidents, which is kind of where my mind goes. I would have thought that motor vehicle accidents would have been higher. But for anyone older than 70, falls is the leading cause of injury-related death. And also it's estimated that every 1 out of 3 persons over the age of 65 years are going to fall each year. So if you're older adults over the age of 65, there's a 33% chance that they could fall in the next year. So pretty eye-opening statistics, I think. And actually, when I was doing a lot of research into falls risk and the care of the older adult, and this dates back to before we were in this pandemic, leading researchers were actually saying that we were in the middle of a pandemic and it was falls in our older adults. So it was actually being talked about on that scale. It's becoming that severe. And the big thing is we have such great advances in medicine, and our older adults are living longer and longer. And at times our bodies are just shutting down, and we aren't doing the necessary things that we need to do to keep up with that aging process. So it catches up to us. So how do we stay upright? Like I talked about, we have four systems that we use for our balance. Okay, and the 4 systems are our visual system, so our eyes, our vestibular system, which is our inner ears. We have canals in both our left and right inner ears that help with our stability. Our musculoskeletal system, so our bones, our joints, our muscles, and lastly, our somatosensory system. And that system's a little more complex. We'll talk about that when we come up on that slide. So we're going to go through each of these four systems, talk about how they impact us, and talk about how they might change as we age. The first is our visual system. We rely heavily on this system to maintain our balance. And how it works is we use our eyes to fixate on objects as we're standing, walking, and that helps orient us to midline and helps to keep our balance. One thing that's important to realize are different situations when we're at home where our visual system might be compromised or decreased, and when we're at a higher risk. So we see a ton of falls in the bathroom or trying to get to the bathroom. Most older adults aren't able to make it through the night without taking a trip to the restroom. And obviously at night it's dark, and the darkness in the room leads to decreased visibility. And if we don't have the proper lighting, if we don't have a clear path from bedroom to bathroom, it's very common to see falls at that point. So one of the biggest recommendations that we make as physical therapists is one of 2 things. Make sure that there's either a night light that's set up in the bedroom, and that if you need more night lights, for example, if your bathroom's not immediately attached to your bedroom, then having more night lights placed like along your hallway or along the pathway so that you can see where you're going to get to the bathroom. The other option would be to, and this is better if the bathroom's close to the bedroom, is keeping a light on in your bathroom and using that to help light the pathway to get from bed to bathroom. Walking around without proper corrective lenses. And this also kind of goes hand in hand with getting up in the middle of the night. Oftentimes we're not sleeping with our corrective lenses, whether that's glasses or contacts. We normally either take them out or take them off. And a lot of times if people are getting up to go to the bathroom, they won't think about putting their glasses back on. They'll just get up and make that trip. But if we have a pretty serious visual deficit and we rely on those corrective lenses, that could be very, very unsafe if we have very blurry vision and our visual system's not able to help us like it normally does. And lastly, standing in the shower when we're washing our hair. Obviously, I don't have that issue, but a lot of people still do. So if we're washing our hair, we go to close our eyes in the shower. We see a lot of falls happen at that point. So one of the big recommendations that we make is to get a shower chair put into the shower stall or the bathtub, so you can sit down while you're washing. It helps increase safety a ton. So that's a big recommendation that we make as well. And when we talk about the visual system and talk about it from an aging process standpoint, just think about even if you're on the younger side of things, as far as the age spectrum, how many people have to wear readers that they didn't rely on readers 10, 15, 20 years ago. And it's because every year our vision can be changing. And as we age, it's very common that our visual system becomes worse and worse. So it's very important to stay up to date with our corrective lenses and make sure we're getting regular checkups with our eye doctor. And I'm just going to stop real quick, check in with Holly and see if any questions showed up in the chat yet, or if I'm good to continue.
All right. There was one question. How would somebody get a shower chair? Can they just go to the store and buy them?
Oh, yeah, that's a great question. Yeah, so shower chairs are relatively inexpensive, normally not covered by insurance unless it's a special case. But you can find them. You can find them at Walmart. You can find them at like a CVS or a Rite Aid. Also, some of the local medical equipment companies in town also would carry an item like that. So you can find them pretty easily. Amazon, you could find them there as well. So you could do a little sticker shopping and find your best option. But there are tons of them out there, and you can really find them just about anywhere.
Okay, that's all for now.
Excellent. Vestibular system. So I have a picture here on the PowerPoint of our vestibular system. Really what the vestibular system is, and if you can see my pointer, it's this blue figure here, and you can see these canals. That's what our vestibular or inner ear system is, and how it functions is as we turn our head different directions, looking left, right, up, down, those canals communicate with our eyes and our brain to let our brain know kind of where our head's moving and let our eyes know where our head's moving so that we can fixate on the right objects and we can kind of keep our wits about us. You'll normally, if you've ever heard of the term or known someone, or maybe even yourself have gone through what's called vertigo, this is normally when that comes up. This is normally what leads to vertigo, is when we have a deficit in our vestibular system. And this is a pretty complex system that requires a lot of different specialists to get on board with. So if you are having vertigo issues, it's normally going to be your ears, nose, and throat doctor, It might even be a neurologist. It's going to be a physical therapist that's involved in your care. And that team is going to try and figure out what's at play, because there's a lot of different diseases and disorders out there that can impact the vestibular system. And as we age, this system, like most others, tends to decline over time. So it can sometimes not be as responsive as it used to be. And also, as we get older, some of those diseases and disorders that I was talking about are more likely to come up. And there's a lot of different things that can end up going wrong with the vestibular system. So if you do experience a fit of vertigo, it would definitely be a good idea to at least reach out to your PCP and talk to them about what's going on, so that they can help you figure out next best steps. The musculoskeletal system. As a physical therapist, this is kind of my wheelhouse, and what I focus on a lot when we're working with individuals who are having balance concerns. So, like we had talked about, musculoskeletal system, we're dealing with the muscles, the bones, and the joints. And certainly, as we know, that system certainly deteriorates over time. If we're getting up in age, or around the age of 60, 70, 80, even 90-year-olds, we know that we're not as strong and as mobile as we were when we were 20 or 30. So we know just over time that system deteriorates. And actually, after we hit the age of 50, every decade, we lose about 10% of our muscle mass. And that's just part of the aging process. And obviously, there's things we can do to delay that or not make that loss as great. And by exercise is really the biggest way to do that. But that's part of the aging process, is we lose muscle mass. We also lose bone density and bone structure. Think of disorders like osteopenia and osteoporosis. Conditions like that lead to a deterioration of our bone structure. But obviously, muscle strength plays a vital role in keeping our body upright. And I asked this question here, and this is almost always a resounding no. But ask yourself about yourself, or maybe your loved one who you're trying to care for at home. Are you or they exercising enough? The CDC recommends that we participate in at least 30 minutes of moderately intense strength training 2 times per week. Are we getting that in? Because that exercise is so important in helping us stay upright. And lastly, the last system of the 4, the somatosensory system. So this is our body's awareness of its position in space. Okay. The best example I can give to help describe this system a little bit more is, imagine if you were out in your yard and you were walking and you stepped in a ditch and your ankle rolled. There's a response. There's an anatomical response that takes place where we get a signal from our ankle that gets shot up into our spine and up into our brain. It says, "Hey, our ankle just stepped down. It turned. We need help uprighting it." So it sends a message to our brain. Our brain quickly sends a message back down to the ankle and says, "Hey, the ankle's turning out. I need you to turn it back in." And it responds, and we're able to catch our balance. Now, as we get older, our somatosensory system, our nervous system, that system doesn't work as well as it used to. Again, part of the normal aging process is that system just deteriorates, and it's not as quick as it used to be. So because of that system not performing as well, it's common to see falls in that very situation. There's also different diseases out there that impact the somatosensory system. One of the most common ones would be diabetes, because what happens with diabetes is, over time, it leads to our nervous system, especially in our outer limbs, like our fingers and our ankles, to not work as well. And we develop, some of you may have heard of this condition before, neuropathy. It's a pretty common side disease that we can end up coming down with as a result of being diabetic. We can also develop neuropathy from other things as well. And that's really, when we're talking about neuropathy, that's really what's happening, is we're having that breaking down of the nervous system, and it impacts our somatosensory system. Okay. So before we go into what more we can do about it, I'll just check in real quick with Holly again, see if we have any other questions about any of those other systems that we talked about.
All right, Mitch, we have a question. What suggestions do you have for moving from a sedentary lifestyle to exercising twice a week? Where does someone begin, and what are some good exercises to help us stay upright?
Oh, that's a great question and an excellent segue into my next portion here. So we will talk about some exercise recommendations as far as the frequency and intensity of the exercise. We can talk a little bit too about some exercises to get started. And we'll also, I'll hit that part in a minute too, about where to get started and how to go about that. So that's a great question, and we'll hit that in just a second. Any others?
Not at this time.
Okay. So moving on, what can we do about it? How do we help ourselves? How do we help our loved ones? At the very least, a robust exercise plan is recommended. There's a ton of research out there that shows if we meet the necessary exercise requirements, just by doing that, we drop our fall risk tremendously. But there's some other things that we can do too. First one, annual vision assessment. At the very least, getting into your eye doctor at least once a year, because like we had talked about, your prescription, if you're on corrective lenses, your prescription can change from year to year. Your vision can get worse. And also, if you aren't on any, or if you don't need any corrective lenses currently, that doesn't mean that as you age, you won't always not need it. So getting an annual assessment, especially once you hit the age of 65, getting in to make sure that either your current prescription is still accurate, or that your eyesight didn't get bad enough that you need corrective lenses at this point. Environmental assessment, and at the end of the talk here, we're gonna dive into an environmental assessment. I actually have a handout that I'm going to share with everyone here tonight. That's provided by the CDC, but they recommend an environmental assessment can definitely happen more than one time a year, but at least once a year, getting into your loved one's home, looking over the home to make sure everything is safe within the home. Like I said, we'll go into more detail about that in a little bit. Medication review. This is a huge one, and I think out of all of these, probably the one that gets missed the most. I can't speak to it enough how important it is to, again, at least on an annual basis, have a conversation with your primary care doctor, and if you can, have a conversation with your pharmacist as well. Sit down with them and ask them, hey, would you just mind looking over my medications just to be sure that there's not a chance that any of these medications could be counteracting another one that I'm taking. Make sure that I still need all of these medications. It's always good if we can decrease the amount of medications that we're taking. And don't be afraid to pose that question again, either for yourself or your loved one, because that can be huge if we can decrease the number of medications that we're on. There's a lot of different screening tools for medications, and we say that individuals are at a risk for what we say is polypharmacy, which is taking too many medications. Someone's at risk, and it ups their fall risk if they're taking more than 4 medications at a time. Now, that doesn't include things like vitamins, but if they're on 4 prescribed medications, 4 or more, that individual is at an increased fall risk just by the nature of how many medications they're on. So I can't stress enough, if there's a takeaway tonight, take that with you. If you're going to your loved one, going with your loved one to appointments, definitely make sure you're asking that question to the primary care doc and even with your pharmacist. And lastly, an exercise program, which we're going to talk about next. So when we talk about these exercise program numbers, I actually just talked about this topic at a facility yesterday. And every time I talk about it, people see these recommendations and they're like, oh my goodness, how do I fit all of that exercise in a given week? And we'll chat a little bit about strategies and ways to do that. But these are all recommendations from the CDC and how much exercise we should be doing, especially as we age. So they recommend 30 minutes of aerobic exercise 5 days per week. So 150 minutes a week. And the big question is, what is aerobic exercise? What does that look like? And aerobic exercise is participating in a type of exercise that's going to elevate your heart rate. Okay. So getting your heart rate up, getting you breathing heavy so that we're taxing the cardiovascular system a little bit. Okay. So what that looks like is different with every individual. So what is considered an aerobic exercise for me is probably going to be different for someone who's 70 or 80 years old. But some good examples would be walking, jogging, if appropriate, swimming, cycling. Sometimes we recommend gardening. Gardening can be fairly strenuous depending on the baseline activity level of an individual. We had talked about this one already, 30 minutes of strength training 2 days per week, 30 minutes of stretching 2 days per week, and 30 minutes of balance training 2 days per week. So to go back and answer that question, if we have someone who's starting out at a very sedentary style, and how do they get started with exercise? It would be very unrealistic of me or anyone else to ask that individual to tomorrow start to do all the things that are on this list. But what we can do is pick one. Okay. So maybe we're going to focus on doing 30 minutes of aerobic training 5 days a week. And let's see if we can make that a routine for 1 to 2 months. So we dedicate 30 minutes a day to get outside and walk. Or if it's cold outside or the weather's not nice, even walking inside. And what's nice about this is you can break it up. I wouldn't break it up any more than 10 minutes at a time. So you could do 10 minutes of walking 3 times a day to hit your 30 minutes. And get in a routine with that. So you're doing that for 1 to 2 months. You have a good routine. You're able to complete those exercises on a daily basis, and then look at adding the next one. So now maybe you're going to add 30 minutes of strength training 2 days per week. So it's just 60 more minutes. It's just 1 more hour of exercise in a whole entire week, and then implementing that into a program. So that's how I normally recommend people get started on an exercise plan. And I think that's the best way, especially if you're coming from a very sedentary lifestyle, to try and work into getting into a sort of routine, because that helps it stick more than doing something for a couple of days and we're just going to fall off if we try and do all of those things right away. As far as actual recommendations of exercise, that's always so hard to give, especially in a live like this, not having the individual present, not knowing what they're able to do right now. My best advice would be to seek out a physical therapist or even a gym in the area, a local fitness gym, especially for older adults. If we're over the age of 65, there's a tremendous program out there called Silver Sneakers, which gives you free access to gyms in the area if they participate in it. And I know there's a lot of gyms in the area that do. So if you're wondering if a gym has that service, just give them a call and ask them if they participate in Silver Sneakers. And that would probably be my best recommendation as far as where to get started exercise wise. So I hope that answers your question. I know I kind of sidestepped it a little bit, but it's just hard to give specific advice, not knowing the individual. And any questions after that, Holly?
Let's see. As far as aerobic exercise, does the heart rate need to go to a certain level is one question. And you kind of touched base on this, gym versus an exercise program at home, the pros and cons.
Sure.
And then, that they just like that you had a realistic approach to starting exercise program.
Okay.
They like that. So.
Oh, very good. Very good. So to answer those two questions, the aerobic question in regards to heart rate, it's actually a really good question. And I'm glad you brought it up because yes, it does matter. And we do want to hit a certain level of intensity. And there's different ways to go about figuring this out. And again, this might be beneficial if you seek out an exercise professional, at least to get started. But generally, you want to be at about 70 to 80% of your maximum heart rate. And a quick and easy way to solve or figure out what your maximum heart rate is you take 220 and subtract that by your age. So, for example, for me, 220 minus 30, so my maximum heart rate would be 190. And then I would take 70 to 80% of 190. And then I would want to, when I'm exercising, I would want to keep it in that target range. So again, you might want to seek out an exercise professional who can kind of help monitor you as you start that exercise, and make sure that you're safe in that heart rate level. But that's generally what's recommended. And sorry, Holly, you'll have to remind me about the second question.
Sure. And it was regarding gym versus home exercise program.
Yeah, very good. So pros and cons to each, and it all depends on your personality and what you would prefer. So gym, you're obviously going to be in a group of people. Some people don't like to have that group interaction, and they'd rather exercise on their own where they don't feel like they're being watched by other people. And other people love the group setting that a gym provides and the social aspect of it. There's obviously benefits to being in a gym and being surrounded by exercise professionals, people who can readily help you, walk you through an exercise if you're unsure if you're doing the form correctly, and kind of help you through that. At home, the pros to being at home as well. You're in the comfort of your own home. Don't have to worry about transportation. If that's an issue, you can pretty much do exercise at any point in the day. I would pretty much always recommend before you start a program, two things. Make sure you have a conversation with your primary care doctor to make sure that there's no contraindications to exercise, that you're okay to do it. And then two, at least when you're first getting started, seek out a professional so you can get a plan in place and you can get some exercises and a routine to follow. And once you get that established, then you can make the decision, should I go to the gym or would it be better for me to continue at home? And at that point, it just becomes personal preference, as long as you're safe to do them at home. But great questions, guys. I appreciate all those questions. So let's talk about fear of falling, because this is huge for older adults, and a lot of times it comes from healthcare professionals, and it comes from even family members as well. older adults get told all the time, hey, you're getting older, you need to slow down, you need to be careful, you need to watch what you're doing. And we say those things in a very loving and meaningful way, but sometimes we say these things and we end up building this construct of fear, and and it causes older adults to really modify their behaviors and how they get around. Just because we're getting older, we shouldn't shy away from activity, or we shouldn't be more cautious of how we move. That shouldn't change just because we get older. So I really, that's just my quick plug. I really think we need to be more cautious at times in how we talk with our older adults and how we kind of broach this subject. But thinking of things like, have you fallen before? Or has your loved one fallen before? And are they afraid of falling again? Have they started slowing down or moving more cautiously because of a fall? Because fear of falling is one of the leading causes of falls. Some people argue it might even be the biggest factor that leads to a fall. And I always give this example to people when I'm working with them is, if I were to be, if I stood up and stood on the edge of my chair right now with my heels hanging off the chair, I would probably be able to stand there and still talk to you guys through this live tonight. But if I tried to do that very same position and I went and did that downtown at the top of one of the new high rises that they're putting in, I wouldn't be as comfortable and as confident talking to you here as I would be up on top of that rooftop. And the only thing that changes is my fear, and because of knowing the consequence and thinking about that. So it's very important to understand how fear can impact performance. So if you're hearing your loved ones say these things to you, if you're hearing them say, hey, I'm afraid of falling, or I'm very careful about how I get around my house. If you're hearing them say that should be a cue to you that, okay, we need to figure something out. We need to get someone in here to help mom or dad and really figure out why that is. Because it's very important to realize that that's not a normal part of aging. So we need to figure out how we can help them through that. And then this is just a rhetorical question that I throw in here for people. Walking speed. Do we think that walking slower or walking more cautious is always the best thing? And I kind of gave it away already. And on the other side, how fast is too fast when we're walking? So I don't expect us to remember these speeds, or these speeds to even mean anything to you guys out there tonight. But I just want to put into perspective how, as we slow down when we age, how that can impact our balance. Okay, so these are all walking speeds here to the left, and it's in meters per second. So people who are walking over 1 meter per second, we found through research that they're normally still able to complete yard work. They're able to climb flights of stairs easily. And as we slow down, so under 1 meter per second, these individuals would benefit from fall prevention. People under 0.6 meters per second, they start to have difficulty with self-care. 0.89 meters per second, able to do household activities. Under 0.6 meters per second, this is when we start to predict future fall risk and hospitalization. These individuals tend to require assistance with activities of daily living. And in order to cross a street safely, we need to be able to walk at least a half a meter per second. So if we're going slower than that, that individual is not able to safely move about in the community because they're not able to cross the road safely. And if we're going slower than 0.4 meters per second, that's predictive of longer stays in acute care and individuals who are likely going to have a discharge to facilities outside of being discharged home. So I'm not expecting you to, the next time you go visit mom or dad, to tell them to get up and walk to the sink and time them as they do it. But what's important here is just to realize that if you notice that your loved one's slowing down at home, know that that's not normal aging. Or if they say to you, hey, I can't get around like I used to, that's not normal aging. So it's important to, if we want to combat falls and fall risk, diving into that and seeing what's going on, maybe bringing it up with their doctor at the next doctor visit, maybe getting a physical therapist or a occupational therapist or an exercise professional involved to see if we're able to help with some of these things. And before I switch screens here to go over some of these resources, were there any more questions that showed up, Holly?
There was a question regarding target heart rate and if there's a way to determine if you're in the zone based on how hard you're breathing and being able to hold a conversation, if that's a good indication.
Yeah, that's a really great way to do it if you don't have the resources available to track heart rate. Is even if you're walking alone, sometimes I'll recommend to people like to try and sing a jingle in their head. And we say if you're having trouble saying or singing more than 3 to 4 words at a time, so if you can't say more than 3 to 4 words or a full sentence without taking a breath or getting out of breath, that normally can give you a rough ballpark idea of how much effort you're putting into the exercise. So that's kind of a down and dirty way to kind of figure it out if you don't have the resources to track your heart rate.
And then, do you have any recommendations regarding an iWatch or Lifeline that could be included in fall alerts?
Absolutely. I haven't had a chance to see one in action, but I know that, and I have mine on right now. I know that the newer Apple watches, the iWatches, have technology built in to detect falls. And I also recommend, if I'm in a home with an older adult who lives alone, I'm recommending a life alert 1,000% of the time, because you just never know. No matter what we do, falls are they can happen. So if we do have that fall, it's important that we have a lifeline to call for help. I've seen it so many times where older adults don't have that life alert or that watch, and they don't have a quick means of getting help, and they're on the floor for 10, 15, 20 hours until a family member comes in to check on them, which is terrible. You never want to see a loved one go through that. So I can't recommend it enough to get one of those life alerts, or the iWatches are even better, because if you were to lose your balance and God forbid you weren't able to activate the life alert because you were unconscious, that I know that the iWatch is able to do that by detecting the fall. So pretty neat technology that we have available to us at this point.
And I think that brings us up to date on questions so far.
All right, very good. So I'm going to switch screens here. So just bear with me for a quick second. I'm going to bring up a couple resources that is available on the CDC website, on the STEADY program. This was a program that they created roughly 3 years ago. I think it was 3 to 4 years ago. And we're going to look at a couple different things. We're going to hit this environmental checklist that I had talked about earlier. There's this really nice fall risk questionnaire that you guys could take and go over with your loved one to get an idea kind of where they stand with things. And also, there's a quick little handout on what you can do to prevent falls. And this actually aligns nicely with what we had already talked about. So I am going to switch screens real quick here. Okay. So the first one is this environmental checklist. And this is super, super nice. And it kind of gives you things to look out for in all different parts of the home. And I won't go through it all, but it has things to look out for as far as stairs and steps, making sure that the stairs are free of objects, making sure that the stairs are well lit, carpeting on the steps, just giving you ideas to check and look into. Making sure that the handrails are fixed and attached well. Checking the floors. Floors are always big. If anyone's ever had a physical therapist come into their home, they're probably talking to you about those deadly throw rugs. So they hit on that here, removing thrugs, or use double-sided tape or non-slip backing to fix the rugs to the floors. Making sure we're clearing the floor of any clutter. Areas like the kitchen. Do you have a sturdy step stool? Bringing things that are on high shelves, bringing them back down to counter level height. Bedrooms and bathrooms. Making sure your bathroom floor isn't slippery. Making sure that you have a lamp in close reach of the bed. So here's a super nice checklist that you can go over, run through your loved one's home and make sure everything looks good. So there's that. There's also this stay independent. So this is the falls risk questionnaire. And again, I won't run through every single one of these. But what you can do with your loved one is go down row by row here and check off each of these items. And each of these, they're scored. So some of them have a 2 value, some of them 1. You'll tally up the score at the end and write it down there at the bottom. And if their total score is higher than 4 points, then they're at an increased risk for falls. And then at that point, recommended obviously getting physical therapy involved, reaching out to your primary care doctor and talking with them about it as well. A couple things to consider. So that's the falls risk questionnaire. And then also what you can do to prevent falls. So some of the things that they have listed here: have your healthcare provider review your medicines, exercise to improve your balance and strength, have your eyes and feet checked, and make your home safer. So pretty much all the things that we had already covered. And then they just go into a little bit more detail here on the next page about what each of those looks like. So if I open our slide back up here, I have the website here that'll take you directly to the that web page that I was on, the CDC Steady program, and then it'll take you to this web page right here. It'll take you to this page, and then all of those resources that I just pulled up, you can find right here. The Check for Safety, that's your environmental assessment brochure, the Stay Independent brochure, which is the falls risk questionnaire, and what you can do to prevent falls. And then they even have a couple other resources down below. They have an example of the chair rise exercise, which is a sit to stand exercise, going from a seated position to standing up out of a chair, and also talking about postural hypotension as well. So a lot of really great resources available to us on the CDC website. So I definitely recommend you guys taking the time to check that out as well. And with that being said, that's all that I have. So I'll turn it back over to Holly to see if any more questions popped up.
Let's see here. No current questions.
Okay. Well, I'm not sure if we'll be on for another minute or two to see if any other questions show up in the chat. But for those of you who were able to hop on the live tonight and listen along, I appreciate it, and I know the ACAP organization with Center County appreciates it as well. And we're just very happy to to be a resource for you guys here in Center County. So thanks again for tuning in.
We'll just, hang out a minute or two. But in the meantime, while we wait, as always, you can log into our Facebook page or our website to learn more about the programs that we're offering. We do meet the second Tuesday of every month. We're going to be doing it virtual for the time being, and the best way to access us is through the Facebook page or the website. And we'll live stream again the second Tuesday of every month starting at 5:30. And we're going to be posting the calendar, the list of events that will be coming up. Now, everyone's aware COVID is here, so it's always going to be subject to change based on everybody's availability and illnesses and whatnot. And that's why we're staying virtual. So as always, if you have any questions, feel free to message us on Facebook, go to our website. And I think that takes it away for now. Let's make sure that there's no other questions coming up here. No, I think that covers it. So I want to thank you, Mitch, for taking time out of your busy schedule to provide some education. I learned a lot. I realized I need to implement a better exercise program. Got to get moving. So thanks for that. All
Very
right.
good. Thanks again for having me.
All right. And we will talk to you soon. Thank you, everyone. Have a good night.